Hi, Dr. Emily Kirby, board certified plastic surgeon in Fort Worth, and I wanted to talk to you about different planes of augmentation. When we talk about a plane of augmentation, we're talking about where the implant is placed in the body. So traditionally, we've always talked about under the muscle or over the muscle. And the muscle that we're referring to is the pectoralis muscle that goes across the chest. It attaches along the sternum right here in the middle, and it actually goes across the arm and attaches to the humerus bone of the upper arm right there. So when we talk about under the muscle, we make an incision on the breast and we lift up the pectoralis muscle and place the implant under the muscle. When we talk about above the muscle, classically or traditionally, we have talked about strictly a subglandular plane. That means under the breast tissue, above the muscle. In that scenario, we make the incision, leave the pectoralis muscle where it is, and put the implant above the pectoralis muscle. There's a newer technique that's become more popular recently because they've actually done studies to look at the safety and the longevity of this plane of augmentation, and that's called the subfascial plane. The subfascial plane means under the fascia. So what we're talking about is a level above the muscle, but under the fascia of the muscle. So now we raise a different level, a different plane above the muscle. We raise this layer of fascia and put the augmentation, put the implant in the subfascial plane. And I like to say that the subfascial plane really gives us kind of the benefit of both the subglandular and the submuscular positions. It has the benefit of being above the muscle in that it is a quicker recovery, a more comfortable recovery, and there's not such a waiting period to see the final position of the implant and the final shape of the implant by waiting for that muscle to soften. It also has a decreased animation deformity. When we talk about animation, when the implant is under the muscle, if the pectoralis muscle has scarred down to the capsule or the scar that surrounds the implant and holds it in place, it can actually distort the appearance of that implant with flexion of that pectoralis muscle. When we go above the muscle, historically the risk of capsular contracture has been higher, but when we go in the subfascial plane, there's enough of a distinction there between separating the implant from the breast tissue and the glandular tissue that now the studies have shown us that it is a safer approach as if it is under the muscle as far as the safety profile goes. That means when we place it into the subfascial position, that implant has a lower risk of capsular contracture as if it were placed under the muscle. And now you know.